And new studies are raising concerns about cancer risk in younger generations. Now, researchers found Gen Xers and millennials, they may face a higher risk for 17 different types of cancer compared to earlier generations. Now, some of the cancers becoming more common in younger adults, that includes breast cancer, colorectal cancer, kidney cancer, and uterine cancer. So what's driving this, and what can people do right now to protect their health? So joining us right now is Dr. Erica Grabinski with Optum Arizona. Now, Dr. Grabinski, thank you so much for joining us today.
Thank you for having me.
I feel like this is a conversation that could span hours, but we only have a couple of minutes.
Yes.
So for people who may be in their late 20s, 30s, 40s, why are we seeing so many different kinds of cancers in them?
So there's not one thing that we can point to specifically, but we look at a multitude of different things, namely lifestyle, right? So we're looking at your diet. What are you eating? Are you eating a diet high in processed foods? Are you exercising, or are you living a more sedentary lifestyle? And with that, with higher rates of obesity, we do see higher incidence of cancer as well. Also want to make sure that you're getting in with your primary care doctor, doing your annual physical exam, following up for blood work, and discussing those screenings that you need to do.
Yeah, a lot of people, I feel like there is this wave of concern, especially for younger people, because it feels like everything gives you cancer. Would you agree with that?
So again, so tough to say,
right?
Because there's so many different contributing factors. Again, environment, how you live your life definitely impacts your propensity for cancer development, but we're also getting so much better at screening for cancers. So namely colorectal and cervical cancer, we're screening younger. The guidelines are changing, so we're able to intervene, diagnose, and treat sooner. So we've made some great strides in terms of screening for cancer.
Yeah, are you seeing more people in their late 20s, 30s, or 40s, anything like that? Are they getting checked for cancer, or is it still something they're like, I'm not going to do it until I experience symptoms?
Right. So generally, people don't come to me if they feel healthy, right? In that 20 to 40 age range, they're like, I feel good. I don't need to go to the doctor. But with these sort of statistics that are coming out, we need to stress, go get your annual blood work, talk about your family history, get an exam, and help prevent those screenings.
Yeah. Why is it so important, even if you are feeling healthy? I mean, you pretty much touched on it already, but just to get ahead of this rather than, wait until you get that diagnosis.
Yeah, so even though we're picking up on 80,000 cases of cancer in young adults annually.
Is that in Arizona or?
It's in the United States annually. So about 4% of the cancers nationwide. Getting in early is how we can stage you early and get you treated appropriately. So,
wow, okay.
Yeah.
Where can we find more information on this if it's, if people are wondering about it?
Absolutely. Go to your primary care provider, talk about your personal history, your risk factors, your family history. Go through how you live your life, and they'll be able to talk to you about what is the appropriate screening and the appropriate timeline for you.
Amazing. Dr. Grabinski, thank you so much for your time and enlightening us on this. I know I just want to ask so many more questions, but thank you so much. Yes, exactly. Hey, and the big takeaway here, don't wait for symptoms to start the conversation. If you have questions about those screenings, family history, or changes in your body, again, check with your doctor. Now, still ahead on 12